We are going to go ahead and get things started. Again, wanted to thank you all for attending this webinar, really geared towards Medicare and hopefully avoiding those Medicare mistakes as people are in retirement. For those that don't know me, my name is Alex Black. I'm an advisor with Integris. Also joined here with Angela Windett. Angela's joined us from Stein Logie Insurance Agency, who really specializes in not only Medicare planning, but also individual health plans. Angela is also a proud mother of two boys. She was a former educator, and she's let me know several times. She used to run track in college, and she brings a unique perspective to this. Her husband actually needed to apply for Medicare early, so she's seen some of those more unique circumstances and really enjoys taking an educational approach to not only Medicare planning, but also health insurance planning for individuals. Without further ado, Angela, would you mind kicking us off?
Sure. All righty.
Oh, wait, I'm so sorry. Angela, one second. I forgot.
Hey,
Kay,
Heather.
would you mind helping our participants understand just some of the ins and outs of kind of working inside of the Zoom meeting, as well as a couple of compliance announcements?
Yes, thank you, Alex. Welcome to today's webinar. Hi, everyone. My name is Kay from Integris Wealth Management. I'm a paraplanner here. And if this is your first time attending a Zoom webinar, I'd like to let you know that we highly encourage audience engagement. There's a toolbar at the bottom of your screen, and you'll notice that there's a Q&A icon with a speech bubble and a question mark inside. As you have questions throughout the presentation, please feel free to ask Angela by clicking on this icon. And we would prefer that you use this button instead of the chat function, just for the smoothest experience. I'll be monitoring the questions as they flow in, and I'll be passing them along to Angela. If there's any question that you want to ask that we aren't able to get to during the webinar, we'll make sure to follow up with you individually after the presentation is over. Additionally, you'll just want to roll your mouse over to the upper right-hand corner of the screen where you can select View and then Speaker View and also full screen mode. Angela has a lot of great information packed into her slide deck with lots of helpful tables, and so we just want to make sure you have the best user experience. Additionally, we do have a quick disclaimer. This presentation is intended for educational purposes only and should not be considered as investment advice.
Okay,
With that, I'll kick it back to you, Alex.
Thank you. Angela, I apologize I cut you off there. But again, just really appreciate you joining us and sharing your expertise within the industry. Please go ahead and kick things off.
All right, sounds good. It's not letting me share, you guys.
Yep.
There it is. Thank you. All right. Good afternoon, everyone. It's good afternoon here. I'm in Charlottesville, Virginia. Hope everyone is doing well wherever you are today. Again, I am Angela Windett with Stein Logie Insurance. A little bit about Stein Logie. We've been in business for over 70 plus years. Several years ago, my boss, Margot, and her brothers bought out their father, and now they run Stein Logie. Our home office is out of Missouri, where Carl and Eric run our home office there. And then Margot, several years ago, moved to Virginia with her husband. In a short little bit of time, she's opened 4 offices. We have an Arlington office, Charlottesville office, Richmond office, and a Winchester. So we continue to keep growing by leaps and bounds. Like Alex said a few moments ago, my start with Medicare was because my husband became disabled. So I hope to share some experiences I may have had, and also just the wealth of knowledge I have about the subject matter as well. Let's get started. So what do we do here at Stein Logie? We're really big about education. If you are becoming eligible for Medicare, or if you're on Medicare, it's important that you understand it. When you're becoming eligible for Medicare, You know, it's something that you've never had for insurance before, and it's what you're going to be on for the rest of your life. So this presentation I'm giving today and ones like these, we do these all around to different financial advisors. We go to senior centers, anywhere that anybody that wants to hear about what we can help with health insurance. We're giving this presentation because, again, education is our top priority with our clients. And not only do we do Medicare, we also do the ACA, or the Affordable Care Act. You may know it as that, but we also are able to help our clients that are not of Medicare age as well. When you're becoming eligible for Medicare, we help you get enrolled in Medicare. Unfortunately, we're not able to help our client, we're not able to enroll our clients into Medicare, but we can give you the step-by-step instructions, and we follow up with our clients to make sure you've done it. And then once you have a Medicare number, that's when we are able to assist our clients with putting them into their Medicare plans based on the desired effective date that you need. We will go in great depths in this presentation about the different parts to Medicare. You've probably heard of parts A, B, C, D, etc. It's important to understand what those different parts are so that you can understand what Medicare plans that you also may need to be put in place once you have Medicare A and B in place. We will talk about things called a Medicare supplement today. You'll hear us talk about Medicare Advantage. We'll talk about a little bit about dental and vision as well. Just to let everyone know, this presentation is geared more towards the 2025 information of what's out there currently. I will sprinkle a little 2026 information out there for everyone that you may not know what that is. So be prepared. There will be some 2026 information available in this presentation today as well. So here at Steinlegge, we are licensed in all 50 states. So I like to kid with my clients that, hey, if I help you enroll into your Medicare plans in one state and you decide to move, hey, make sure you move and have a spare bedroom so I can come visit you. It's just nice to know that you do not have to go find another broker because we are licensed in all 50 states. A little side note that I would like to bring attention to folks. I don't know if anyone is watching this presentation outside the US, or if you are thinking about moving outside the US, it's important to talk to us here at Steinlegge and understand when you need to take Medicare. Because if you do not take Medicare and you're living outside the US, and then you decide to come back into the US and live maybe the rest of your life, and you don't have Medicare, there could be some penalties and so forth, or delay in being able to get Medicare. So it's important to talk to us so you understand when you need to take Medicare if you're going to live outside the US. And another thing about us here at Steinlegge, besides being licensed in all 50 states, I would say that we are most likely appointed with all the carriers as well, probably about 90% of them. So when we show our clients the Medicare options that are available, we are showing almost every single option that's available. Obviously, some carriers will not work with us if we do not live in the state, but that's very rare. So we are usually able to show all the options that are available to our clients. So what are we going to cover today? We're going to talk about who is eligible for Medicare so you can understand it's not just the person that's turning 65. We'll talk about the different parts to Medicare, and we'll talk about the different Medicare plan options that you can choose from. We are big also, besides our education, we're also big about staying up to date on what's going on with legislation. There were some changes that happened this year. There's some more changes for next year. So it's important that you understand those because they may affect you. One thing that we'll talk about towards the latter part of our presentation today is IRMA. If you don't know what IRMA stands for, it stands for Income Related Monthly Adjusted Amount. This is a surcharge that can be added to your Medicare Part B as in boy and Medicare Part D as in dog premiums if you have high income. And we'll discuss what that is towards the end of the presentation this afternoon. So let's talk about who's eligible for Medicare. So anyone turning 65 is eligible for Medicare. If you are on your Social Security benefits already prior to turning 65, when you're turning 65, you will automatically be enrolled into Medicare. If you are not on your Social Security benefits when you're turning 65, it'll be your responsibility to enroll yourself into Medicare. But when can you enroll into Medicare when you're turning 65? You can enroll 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. They call this your initial enrollment period to Medicare. Now, also, if you have a birthday on the first of any month, you are also able to start your Medicare the month prior. For example, today is October 1. It's hard to believe we're almost through 2025. But if today was my birthday and I needed to go on Medicare, I could have actually started my Medicare September 1. And that only applies to someone that has their birthday on the first of the month. Everybody else, your Medicare will start the month of your 65th birthday if you're taking it when you turn 65.
And Angela, that is state specific, correct?
Excuse me?
That is state specific?
No, that is the Medicare. That is the Medicare rule. That's the federal rule. That's not state specific.
Thank you.
Yeah. There are many people these days that are working well past 65. One thing you'll have to understand is if you can delay Medicare and when you're working, we'll talk about that in my next slide. But if you are delaying Medicare and working past 65, you are eligible for Medicare when you're ready for it, but your enrollment is different. You will start enrolling in Medicare 90 days before your desired effective date. Using today as another example, if I wanted Medicare to have started today, I would have started the process in July. July 1 is when we start helping our clients. You want to use that full 90 days to apply, because you can either apply online, you can take your forms to the Social Security office, you can go see someone in person. But then after you've done one of those things, it depends on how long it takes the Social Security offices to process your application. And nowadays, you want to give them the full 90 days so you get that desired effective date. A lot of Social Security offices nowadays are not accepting walk-ins. You have to have an appointment if you want to go in. So again, if you don't want to set up that appointment, or if you try to get an appointment and it's a lot later, probably applying online or dropping off your applications and the drop-off boxes are probably the two fastest ways to apply for Medicare if you've delayed it. Folks that are under 65 and disabled for 2+ years are also eligible for Medicare. Again, this is where I got my start. My husband became disabled at the age of 50, so he was on Medicare already 15 years prior to turning 65. He's 66 now. So again, I have learned a lot from what I have seen from his experiences. So I feel like I have a lot to offer to clients about my experiences. Someone who's under 65 and diagnosed with end-stage renal disease is also eligible for Medicare as well. So let's talk about the folks that are working past 65. Again, it's very, very common that people are working well past 65. If you're one of those folks, one thing you need to understand is the size of your employer. If your employer has less than 20 employees, at the age of 65, you do need to take Medicare. Then your option at that time is, do you have Medicare as your primary and your employer insurance as secondary, or does Angela help me with Medicare and Medicare plans? We are able to do these comparisons with our clients, so you're doing what's in your best interest. When it comes to the employer size, it does not have to be part-time, full-time. It can be a combination. It just has to be 20 or less. That's considered small employer. You will have to take Medicare at 65. And you ask, well, why would someone keep their employer insurance as their secondary? It's a very good question. One reason may be if they have a spouse or they have dependents that they still have to keep insured, they need to keep them on that employer plan. But again, we will help that individual make the best decision depending on their circumstances. Now, if an employer has 20 or more employees, and remember, it doesn't matter if they're part-time or full-time, but if there's 20 or more employees, someone can delay Medicare until they're ready. We do encourage clients to start talking to us 12 to 18 months before their 65th birthday, so that you know, hey, am I delaying Medicare? Am I taking it? Or am I delaying part of it and taking some of it? Again, 12 to 18 months is a good time to start talking to us here at Steinlegge so we can kind of formulate your game plan. When you are turning 65 and you have large employer coverage, large employee coverage, again, 20 or more employees, where you can delay Medicare, you want to talk to us. Depending on your circumstances with your employer health insurance plan, we may give you guidance to take Medicare Part A, or we may not. And the reason that is, if your employer health insurance has an HSA, a health savings account, not an FSA, but if your employer insurance has an HSA and you are contributing to that HSA, and may say maybe your employer is also contributing to that health savings account, our guidance would be not to take Part A. Because if you contribute to an HSA and you have Part A of Medicare, that money is not tax-free. And
Yeah.
of course, I stay in my lane and I'm the broker, but I'm not a tax advisor, but I'm sure that money's not tax-free. So, make sure you're getting the right recommendation if you are planning to delay, should you take A or not. That's going to be so important. Now, if you get advice to delay Medicare Part A and B, when you do want Medicare, say we'll use this example today, again, October 1, we would have started helping you apply July 1. You would have submitted, say you applied online July 1, you're going to get Part B for 10/1, but your Part A effective date is going to go back 6 months. Again, federal government makes these rules. We just have to abide by them. So if I started applying for Medicare in July, my effective date for Part A, going back 6 months from when I start applying, that's June, May, April, March, February, January. January 1, my Part A would have started for 2025, and then B is going to start 10/1 of 2025. And, the reason, if you have delayed Medicare because you're contributing to the HSA, going back that 6 months, then we know for that client and that example, they need to have stopped contributing to their HSA at the end of 2024. Now, depending on the circumstances of when we talk to you, sometimes we have to give guidance to maybe you need to pull out money, maybe you've over contributed. But this is where one of the areas where we really excel over a lot of people you may talk to, because they're not comfortable about talking about HSA and the contributions and things like that. We're very well versed in this area. So again, if you've delayed Medicare A and B, when you start applying, your Part A effective date does go back 6 months, but B is for the desired effective date that you're looking for. Now, if you've also delayed Medicare, and if anything were to happen to your job, if you had to quickly retire, something's happened, or if you were to be let go from your job, one thing you need to understand is COBRA insurance is not active employer insurance. So you have to take Medicare right away if you don't have any other options, because COBRA cannot be your primary health insurance. Most likely what will happen is if you were to take COBRA and you have a claim, COBRA is going to see your age, see that you're, of Medicare age, and there's a good chance they're going to deny your claim. Now, the only person that can clarify if COBRA will not be considered the only person that you would need to speak to is your benefits or your human resources person, and they can tell you if COBRA would be considered primary or not in the situation when you're eligible for Medicare. There is verbiage and like a summary of benefits, evidence of coverage with the employer plan that specifies that. And 99% of the time, COBRA cannot be someone's primary health insurance. But we have seen that like 1% where there are some times where COBRA can be primary, but it's very, very unlikely. So Medicare cannot start in it cannot start in the middle of the month. Medicare can only start at the beginning of the month. So if something happens with your employer insurance, hopefully you'll have coverage with the employer plan through the end of the month, so you have no gap in coverage. But again, talking to your benefits person or your human resources person is the one that can clarify that information for you. So again, it's very important to understand the size of your employer. If you are borderline on that 20 employee mark, make sure you're staying in touch with your benefits person to understand that. I have seen people that were not aware that their employer dropped under 20, and then they had to get Medicare in place very quickly. So just make sure you're aware of your employer size for sure. So what are the different parts to Medicare? That's what we're going to talk about next. So let's talk about original Medicare. So if you enroll into Medicare, you will get a red, white, and blue VIP Medicare card. It'll have your name on it. It'll have your Medicare number. And that Medicare number used to be your Social Security number. It is not your Social Security number anymore. It is a number and letter, unique numbers and letters to you. It's your identity. So you want to be very careful with who you give that Medicare number to. I will tell you that no one should be calling and saying, hey, Angela, can I get your Medicare number over the phone? That should be a big red flag. You should hang up on that person and not talk to them. One thing everyone needs to be aware of, there is so much scam going on that you do not want somebody to steal your identity. For example, we have people that will call and say, hi, is this Angela? And if I were to say yes, they can tape record you saying yes, and they can use that yes and disenroll you from your Medicare plans. So again, be very careful. I tell folks, and do not pick up the phone if you don't know who it is. Let it go to your voicemail. If it's somebody that really needed to speak to you, they'll leave you a voicemail. Most of the time, especially this time of year, Medicare annual enrollment period is starting October 15th. If you're on Medicare, you're gonna get inundated with a lot of calls. So again, you want to talk to us here at Steinleggy because we're appointed with all the carriers. Who else would you want to talk to? And because a lot of these people are individual carriers calling you, and they're only giving you their side of what's being offered. Here at Steinleggy, we can show you all the Medicare options that are available to you based on where you live at. So again, going back to this original Medicare, you'll have this Medicare card with your name, your Medicare number. It'll list Medicare Part A and Medicare Part B on it. Now, Medicare Part A, that will cover you 80% to go to the hospital. Medicare Part A is usually free for folks if you or your spouse have paid FICA taxes for 10 years or worked 40 quarters. Part A of Medicare is free. Then and Part A has a per 60-day deductible. This year it's $1,676 in 2025. Next year, it's looking to be around $1,716. So it does change every year. Everyone that's on Medicare gets sent a Medicare Me and You book. Sometimes the updated information's in there, sometimes it's not. I will tell you right now for 26, it's not in that book. So, Social Security will send you a letter if you're on Medicare at the end of the year, and they'll tell you what your Medicare premiums are going to be, and they tell you about the deductibles for A and B as well. So again, Part A is usually free for folks. Then there's Medicare Part B. Medicare Part B has a premium that you pay every month, and it covers you 80% to go to the doctor. And this year in 2025, the Part B deductible is $257. It's looking to be $288 for 2026. In regards to the Part B premium, it's $185 a month. Now, if you are on Social Security, your Medicare Part B premium automatically comes out of your Social Security check every month. You do not get a choice. If you are not on Social Security, Medicare will send you a bill for 3 months at a time. So if I went on Medicare today for 10/1, my first bill is going to be for October, November, and December. It's about $555. We encourage our clients to pay it. And then in that same bill, there are instructions on how you can set up your Medicare Part B to come out of your personal checking account. I can't express enough, out of sight, out of mind is so important. Because you don't know if your check gets to them and it gets processed. If Medicare Part B were to get canceled, it's a ripple effect. Your Medicare plans get canceled, you just can't pay the bill and everything goes back to normal. You could have to go through medical underwriting to get your plan back. You may be penalized for not having a plan depending on what it is, et cetera, et cetera. So again, if you're not going to be on Social Security benefits, again, that's pretty common too these days, set it up to be drafted monthly out of your checking account. Now, Part B of Medicare can cost more than the standard amount this year of $185. We will talk about that. That's called IRMA, and how that is determined is Social Security goes back 2 years on your household income every year to determine if your Medicare premiums are going to be higher than the standard amount. If you file taxes with your spouse, they're looking at the household income for both of you because you file taxes together. If you're a single individual, then you're only looking at your income if you're single. But we will talk about the income brackets, what it costs, and things like that towards the end of the presentation. But right now, if you just have original Medicare, Part A and B of Medicare, you have 80% coverage to go to the doctor, the hospital, the ER, and you have nationwide coverage. You can go to any doctor, hospital, or ER that accepts Medicare if all you have is original Medicare. And about 99% of all doctors, hospitals, and ERs in the United States do take Medicare. So let's talk about how we're going to fill in these gaps. Because if you have original Medicare, 80% coverage to go to the doctor, hospital, and ER, you have a 20% gap that's not covered. You're also not covered for your prescription drugs. You're also not covered for dental and vision. So how are we going to cover these things? So you have to be enrolled in A and B of Medicare. Option 1, you can get a Medicare supplement. You'll also hear people call it a Medigap plan. Just depends on who you're speaking with. It's the same thing. In this presentation today, I'm gonna use the terminology Medicare supplement. If you get a Medicare supplement, that's just gonna fill in the gap that Medicare doesn't cover. Then you would have to get a Part D drug plan to cover you for your medications. And of course, there's a premium for all of these things. And then if you're interested in dental and vision, you would have to get a dental and vision policy. Now, just a little side note about dental and vision, it is optional and you can get dental and vision anytime during the year. But I just want to tell people that, it's dental is not a Medicare plan, it's an individual plan. So if you are, say you're married and your spouse is younger than you, but you're eligible for Medicare, you can go on dental and vision together. Just want to clarify that dental is not a Medicare plan, either is vision either. You and your spouse can also go on vision together, or if you have dependents that you need to cover, you can be on a family plan together for dental and vision as well. So this is just one option you can have if you have original Medicare. You can get a Medicare supplement, a Part D drug plan, and then you can get dental and vision. So there will be a separate card for each of these plans. The other option you can have, again, you have to have original Medicare, but you're tucking that red, white, and blue card away in your wallet. And a Medicare Advantage plan, depending on the plan that's available in your area, because these are very zip code specific, you can have a Medicare Advantage plan, and it's going to be very similar to maybe an employer plan that you've been on, or maybe if you're currently on the ACA or the Marketplace. That's the best way I can say that the Medicare Advantage plan is. It's very similar to an employer or an ACA plan. And with these Medicare Advantage plans, it's one plan and it has medical coverage, drug coverage, dental, vision, and hearing all in one policy. And depending on the plan, you know, there's different carriers out there that sell these plans. And depending on the coverage of the plan, those are the details of your plan. So it's not this 80-20 like it is with a supplement. Again, you put that red, white, and blue card away. You have to have it, but the details of the plan depend on the plan you sign up for. And we'll go in more detail here in a moment about more about Medicare Advantage. So we're going to break down this Medicare supplement option first. Again, you have Part A and Part B of Medicare, 80% coverage to go to the doctor, hospital, and ER. And if the doctor, hospital, ER take Medicare, they take any Medicare supplement that you go with. Okay, that is the rule by the federal government. So right now, there are several different supplements out there. The most popular supplement, Medicare supplement out there is called the Plan G, as in George. If you turn 65 after 2020, Plan G is the plan that you would most likely go with. If you turned 65 prior to 2020, there was a supplement called the Plan F that folks turning 65 these days cannot get anymore. If you are on this call and on a Plan F, or you know somebody with a Plan F, just real quickly, I'll go over what that is. A Plan F supplement is you pay your premium every month for your supplement, and then you're covered at 100%. There are no copays, no deductible, and there's no cutoff of how much they'll take care of if something were to happen to you. So again, the federal government did not want a plan that was that simple, so that's why they created the Plan G. Now, if you're eligible for a Plan G, that plan, you have to meet the Part B deductible every calendar year. Again, the Part B deductible this year is $257. It looks to be going up to $288 for next year. So whenever you go to your first doctor, hospital, or ER visit, you have to meet your deductible with one of those visits. And then after that, you're covered at 100%. With the Plan G supplement, there are no copays. You have that small deductible. And then after that, you're covered at 100%. So again, if something bad were to happen to you, say you ended up having to have a surgery and maybe it didn't go well, you had to have another surgery. Again, as long as the doctor, hospital, ER takes Medicare and you've already met your deductible, you are covered at 100%. And I can give you a good example of this. This happened to my husband last year. Unfortunately, my husband has some health issues, and he had to have the toes on his right foot amputated. He had the surgery in February. We had already met the Part B deductible last year. So when he had his surgery, we did not see a bill. Unfortunately, the surgery was successful, but the healing process was not. So my husband ended up having to have 3 additional surgeries last year. He had a skin graft that didn't work to heal his foot. He ended up having stem cells put on his foot that didn't heal. He ended up getting an infection where they ended up having to go in and amputate a little bit more. That's what ended up healing his foot. But the thing is, I never saw a bill for any of these things. So that gave us peace of mind that the supplements can give you peace of mind, because again, if anything bad were to happen, if you met your Part B deductible and the doctor, hospital, ER taking Medicare, you're covered at 100% with your supplement. It definitely can give you peace of mind. It did for me in this situation, for sure. In regards to the supplement, Plan G, Plan F, they also give a $50,000 benefit for foreign travel. So if you are going outside the US to have vacation or go visit someone, you do have a $50,000 lifetime benefit. But you know, that is not recommended to be the only thing you have if you're going on vacation. We recommend you also go get traveler's insurance, because obviously if there was an emergency or something bad were to happen, $50,000 would probably go really quickly. So we do encourage you also to get traveler's insurance, but you do have some protection with your supplement. When you go on Medicare at 65, or if you go on Medicare Part B later because you've delayed it because you worked a little bit longer, when you take Part B of Medicare, when you go on your supplement for the first time at 65, or when you take Part B for the first time, There is no medical underwriting with a supplement. Okay, we're going to talk about the Medicare Advantage option here in a moment. But if I went with Medicare Advantage first for my Medicare plans when I was eligible for Medicare, and then say a couple years down the road, it said, something happens and it makes me want to have a supplement now. At that time, if I want a supplement, I will have to go through medical underwriting. And you're like, well, what's medical underwriting, Angela? Do I have to go have an exam? No. Medical underwriting is a list of questions that each carrier has that you would have to answer depending on which supplement you want to go with. You answer the questions, and if you're answering no to these questions and you look favorable to be able to pass medical underwriting, then we are going to submit your application to the carrier, and then the carrier is going to take it from that point to dig into your health for the last 5+ years. And then they're going to either say, yes, Angela, you can have it, or no, you can't. It's not going to be in the middle where we'll give it to you, but we're going to increase your premium to this amount. No, it's either a yes or no. So when people have a hard time making the decision about which option to go, the supplement would probably be our advisement, because you can at least have that supplement at that time with no medical underwriting, and you can always switch to an Advantage plan down the road. But to go from Advantage to supplement, you have to go through medical underwriting. Now, another question you might be thinking is, can I change my supplement anytime during the year or during the Medicare annual enrollment period? So it will depend on the state that you live in. So no, you cannot change your Medicare supplement during the Medicare annual enrollment period between October 15th to December 7th. You would have to go through medical underwriting. But depending on the state that you live, let's use California as an example, since I think a lot of you may live in California. But for example, if you live in California, you have what they call the birthday rule in your state. And what that means is, let's use my birthday, for example. My birthday is June 27th. If I'm on a Medicare supplement and I want to look at changing it to a Plan G to a different carrier, maybe I heard a different carrier was cheaper and I wanted to change it. What you can do is shop your Plan G during the month of your birthday. And then you can complete an application on your birthday or after during that same month, and then it would be effective the next month. For example, if I shop during June, I know what I want. June 27th, Angela sends me the application on my birthday, or June 28th. I fill it out, I sign it, send it back, and then Angela's going to have my new coverage for July 1. That's how the birthday rule works. Now, depending on other states, not all states have the birthday rule. Some states have the anniversary rule. Just to explain what that is very quickly, if I signed up for my Medicare supplement in October, because that's not my birthday month, every year I can shop my plan the month prior, which would be in September. And if I wanted to switch it to a different carrier, I fill out the application the month prior, and it would be effective the next month. Now, again, birthday rule, anniversary rule, this is just changing the carrier. If you ever wanted to change your supplement G, and if there was something else out there that came out better or a different supplement, to change your supplement, that will require medical underwriting. But changing the carrier, you can do that during your anniversary rule or your birthday rule. But some states don't even have these rules, and if you're in a state that does not have these rules, then you have to go through medical underwriting to change your supplement. So again, if you have original Medicare A and B, you can get a supplement that you'll pay a monthly premium for. You will get a Part D drug plan based on your medications. And what we do here at Steinlegge is we get the name of your medicine, the dosage, how often you take that medication. Is it a tablet or a capsule? Do you get a 30 or 90-day supply for your medicine? And do you like to go to a retail pharmacy, or do you like to do mail order? I take all that information, and it tells me exactly what drug plan to put you on at that time. Now, you can change your Medicare Part D drug plan every year between October 15th to December 7th. That is the Medicare annual enrollment period. And we do free reviews with our clients every year. So if you're a client, we review your plan every year at this time. You fill out our review form that we send you. We'll do a review, and we'll either say, hey, stay put, or we'll recommend you to go to a different plan. But this is the time to change it. If you don't look at it, you are stuck on the plan that you're on for the next year, and you might not be very happy. So we tell clients, even if you're happy, fill out our review form, because it's another set of eyes looking out for your best interest. And we're telling you if you should stay put or you should change it to a different plan. You know, formularies change every year, premiums change. That's probably the biggest thing that's going to be the sticker shock for people on Part D drug plans for 2026 is the premium increase. That's so important. These two things are probably the biggest things you want to check: the premium increase and the formulary. Are my medicines still covered the way that they are right now? If not, maybe your plan is not the right fit for you for next year. So review is so important.
Angela, that's really helpful. And if we could stay on that slide for just a moment.
Yes, sir.
A couple of questions. One is just if I'm not taking prescription drugs, should I enroll in Part D?
So that is a very good question. Of course, I would say yes, take a Part D drug plan. We would get you the cheapest plan that's out there, because again, you can change that plan between October 15th to December 7th if you start taking on new medicines, and we need to make that change. Because just because you take on a new medicine doesn't allow you to change your plan. The other side of it is, if you don't take a Part D drug plan, you are penalized for not taking one. And you are penalized for every month you go without one. For example, if I were to go on Medicare today and I go October, November, December of this year and all of next year, I've gone 15 months without a drug plan. And then I go to Angela and I say, hey, I think I need a drug plan now. And Angela, you know, puts me in a drug plan that's $20, but when I get my bill, it's you know, 30. You know, every month that penalty adds up. And again, I can't say if it'll be a $10 penalty or not, because, you know, Medicare is the one that dictates the penalty. It's probably about 33 cents a month right now. But again, it adds up for every month. You cannot enroll anytime you want. You have to wait to the enrollment period. And whatever that penalty is, say it's 7, 10, etc., that penalty is added to your Part D drug plan every month for the rest of your life.
Oh my gosh, that's good to be aware of.
Absolutely. And I get it, especially if you're not on something. Why pay $20 for something you may not use, but it protects you from that penalty. And also it protects you from the unknown. I didn't bring my crystal ball today. I don't know when things are going to happen to folks, but you never know when something bad could happen, and you do need a prescription drug plan.
That's really helpful. And I also wanted to go back to the comments you were making about switching between either kind of traditional A, B, D, and a supplemental, and an Advantage plan or a C plan. And I believe the clarification is really just, at what point are you subjecting yourself to potential underwriting for that supplemental plan?
I mean, obviously, if you do an Advantage plan right off the bat when you turn 65 or become eligible for Medicare for the first time, you know, if you want to move to a supplement down the road, you're going to have to go through medical underwriting.
That's really helpful.
Yes. And then also, you know, depending on the state where you live at, you need to understand, hey, can I switch my supplement anytime during the year? If not, it's medical underwriting to make a change. You know, if you have a state, again, that has the birthday rule or the anniversary rule, and you don't take advantage of those opportunities in your state to make those changes, if you do want to make a change sometime different than those periods of time, then you are subject to medical underwriting.
That's very helpful. Thank you.
Yep. And again, change the birthday rule and anniversary rule, changing from carrier to carrier, you're fine. It's if, you know, obviously, if you go from a plan F to a G, you would have to go through medical underwriting at any time if you want to change the plan.
I see. Thank you for that.
You're welcome. Are you ready for me to continue?
Please.
Awesome. All right, so let's talk about this Medicare Advantage option. Again, you have to have original Medicare, A and B. You're going to tuck that red, white, and blue card away. And then your Medicare Advantage plan, again, is going to be zip code specific to where you live at. If you're in California, what's offered to you may not be offered to me here in Charlottesville, Virginia. So I do have clients all the time saying, "Oh, what my Aunt Susie has, there in Florida." Well, I might not be able to get that person that plan because they are zip code specific. Again, these Medicare Advantage plans are very similar in the medical and drug coverage, like what you're accustomed to with an employer plan or like an ACA marketplace plan. These plans can be HMOs or where you have to stay in your network, or they could be PPOs where you have that flexibility of going in and out of your network. I will tell you for 2026, it's looking that a lot of these PPO options, carriers are going to try to go more HMO. So you probably see less PPO options on the Medicare Advantage side starting in 2026. Also, these Medicare Advantage plans include dental, vision, and hearing. Some of these carriers in the past have had robust dental, vision, and hearing to try to persuade you to go with them. Have a $3,000, $5,000 dental benefit. I would say next year, we're going to see more of dental coverage of a cleaning, and that's all you're going to get. No dental benefit. You might as well just go buy a separate dental policy in that scenario. So we are seeing that these perks that carriers used to be giving are not going to be giving them out as much as they used to. And again, it's going to depend on where you're living at. A lot of these Medicare Advantage plans do offer things like gym memberships, over-the-counter cards. They may say they'll give you money to go pay your electric bill. I mean, they're very savvy on how to try to sway you. But the main thing is you need to make sure your doctors and your medications are covered. That should be your top priority. And you can change your Medicare Advantage plan every year between October 15th to December 7th. Unfortunately, doctors, hospitals, ERs, they can leave during the year, just like you hear things. One big thing for us was John Hopkins in Maryland, United Healthcare. That was a big one. They pulled out of the Medicare Advantage. I can't tell you how many people called me because they didn't think they had coverage anymore, but they had a supplement. And unfortunately, the information that they were providing folks was not clear. It did not mention Medicare because remember with a supplement, if they take Medicare, they take your supplement. With an Advantage, they have to take your plan for you to be covered. And John Hopkins pulled out of all the United Healthcare Medicare Advantage plans recently. So that can happen during the year, and that can definitely blindside folks. And that doesn't allow you to change your plan. You're on it until the rest of the year, and then you can change it during the medical annual enrollment period. One thing for next year, we're also seeing with the HMOs is that a lot of things that didn't need prior authorizations, like maybe to have a certain procedure, that kind of thing, you were seeing going to need a lot more prior authorizations with an HMO Medicare Advantage plan. So just want to make sure you're aware of some of these things that we're hearing that are going to change for next year.
And Angela, just for the sake of the audience, for those of us that might not be as familiar with HMOs versus PPOs, can you just kind of turn that into layman's terms?
Sure, absolutely. An HMO, you have to stay in your network. So the doctor, hospital, ER has to take your plan for you to be covered. Okay, if your doctor, hospital, ER is not in the network, you have no coverage.
Yep.
A PPO gives you that flexibility where you can see doctors in your network, but you can see doctors out of your network. Okay, you pay one cost for being in network, but then it's obviously going to be a lot higher if you're out of network. I will tell you, if you're on Medicare Advantage with a PPO, and if your doctor is not in network, you definitely need to clarify if they take your plan, because doctors have not been happy with some of these Medicare Advantage plans, and hospitals and ERs as well. And if they do not take your plan, just because you have a PPO doesn't mean you have coverage. The only way to have definite coverage is that the doctor is in network. If they're out of network, it doesn't mean that they accept your plan, and you would have to get that clarified.
That's helpful. And then a question for a situation where a provider, like a major provider like a Johns Hopkins, hops out of an Advantage plan, are there any exceptions for people that want to switch from this C or Advantage coverage back into traditional Medicare?
They can do, I mean, obviously, if they want to do that, they can during open enrollment. They can drop the Advantage plan and just have original Medicare. But if they want the supplement at that time, they're going to have to go through
Subject to
medical
underwriting.
underwriting. Yeah, so think about things about your health, maybe your parents, your siblings, things like that. May give you a good picture, maybe what your health may look like down the road. That may help make the decision. I mean, I will tell you, looking at this slide here, this is my next slide. This shows you that, a lot of people were going probably 50-50 with Medicare Advantage over these last several years. I think we're going to see a decline with that because these Medicare Advantage plans are not as there is an exposure there, obviously, that's different than the supplement. And this exposure is going to get a lot bigger with them slimming down plans from PPOs to HMOs. And we're going to see also, like, maybe if you had a $40 copay one year, it's going to go up to 60, 80. So the coverage is not going to be as good as it used to be, for sure.
That's helpful to hear. And Angela, just so that you know, we've got about 5 minutes left. I know that you have a
I've got a lot of slides, so let me talk really quick, okay? All right.
Please, and if I could, before you jump in, if there are any major issues that you see people or your clients specifically running into, please hit on those with the time that we have left.
Yeah, absolutely. So again, these are your options that you have available when you enroll in Medicare. You can either go with option 1, the supplement and drug plan, or you can go with option 2 with the Medicare Advantage plan. This year with Part D drug plans, with regulation changes, they had the Inflation Reduction Act. Medication costs were capped at $2,000 this year. You had to pay your $590 deductible first, and then between you and your Part D drug carrier, once you reach $2,000, you were covered at 100% the rest of the year. This was a big change. It helped a lot of folks that had expensive medications. It will continue for next year. It was renewed. The deductible is going from $590 to $615 for 2025, and the cap is going from $2,000 to $2,100. And again, after you've hit that cap, you are covered at 100% the rest of the year. Some things to think about if you're on Medicare, or when you do a review, when you are on Medicare, is look at your formularies, see if your medicines are still going to be covered the same way, because again, we're seeing those change every year. And again, we're seeing, depending on the medications, a lot of brand name medications are requiring prior authorizations. So don't wait till the last minute to fill that medicine. If you need a prior authorization, it takes time for the paperwork to get to the doctor fills it out, then the doctor sends it back to the carrier. So that's a process. So it may not happen within 24 hours. So make sure you're giving yourself enough time to get those name brand drugs filled if you have to have a prior authorization. And it's only good for 365 days. So right now, if I were, say, on carrier X for my Part D drug plan, and I'm changing to carrier Y for next year, that prior authorization is not good anymore because I changed my carrier. I have to get a brand new one. So, but if you're still with the same carrier, after 365 days, you have to get a new one. All right, IRMA, really quick. We talked about that at the beginning. If you have high income, your Part B may cost more than the standard amount of $185 this year. How that is determined is Social Security goes back 2 years on your income every year to determine what you pay for Medicare Part B and Medicare Part D. For example, this year in 2025, they're looking only at the household income from 23. Again, if you're married and file taxes together, they're looking at that household income. And if you're a single individual, they're just looking at the that single person's income. And here are those income brackets. If you're married and you made under $212 in 2023, all you're paying is the standard amount, same as somebody that was single at $106,000. But then you can see these levels to the income bracket where you can see where the Part B and Part D IRMAs are on this chart. That is added for Part B. Everyone pays $185, but then you have an added IRMA to the Part B every month. And if you're married, remember on Medicare, you're individuals, so you each would have to pay IRMA if you're married and you're both on Medicare. And then there's IRMA added to your Part D drug plan as well. And we can help folks with an appeal. A lot of things that are common that we help clients with an appeal for is maybe if you stopped working or work reduction, if you became divorced or widowed. Those are the common things. The things that you cannot appeal IRMA for are investment income and capital gains. And this is another thing that sets us aside from a lot of folks because we're very, very versed in IRMA, all the ins and outs, and we help our clients with an appeal if you can do it. If you file an appeal, it takes about 90 days. So you are continuing to pay those higher amounts. You'll get a letter from Social Security. If they reduce you to one of these lower levels or to the standard amount, then they will give you a credit for the extra Part B and D that you've paid. And then they'll reduce the Part B and D till you've exhausted your credit. They'll reduce your Part B and D till you've exhausted your credit. They're not giving your money back.
Well, that's a wonderful place just to stop to let people know that there is an opportunity to appeal those IRMA adjustments if they are getting maybe higher than anticipated costs that could potentially be excused for a reason or another. I really do want to thank you for your time today, representing Steinlage Insurance very well. Obviously a great resource, and they will review your situation at no cost. So they will do a comprehensive analysis of your insurance situation to see what opportunities are available to you. In addition to Steinlage, every state does offer a free, well, I should say, a tax-paid service to its individuals. California's is known as HICAP. If you are interested in learning about those resources, you're obviously welcome to reach out to us as your advisors to help you navigate those issues. And again, I want to thank you all for your time today. Hope you enjoyed the webinar. Angela, I really, again, appreciate your time and wonderful presentation. Thank you so much, everyone, and thank you for joining us for lunch hour.